Everyone for joining our monthly now PH partnership call. My name is Justin Jeffrey. For those folks who don't know me, I've been working within these calls now for the past 3 years. I'm joined on this call with a couple of my colleagues. We have Celie Caleppo and Gina Hernandez. If there are any questions throughout this call, please feel free to either unmute and come online or write in the chat box or direct your messages directly to either Celie or Gina. A couple other things before we start. We do have interpretation available throughout this call. We have ASL interpretation, which you should see on your screen, spotlit for everybody. And we also have Spanish and Somali interpretation available as well. We are just asking folks to please locate the globe on the bottom of your screen if you're on a desktop, and if you are on your phone, it's going to be the 3 dots, bottom right corner, and select the icon that looks like a globe, and please select the English room. By doing so, when we invite the interpreters in, they will come into the English channel and let folks know where to find them. And with that, I'm going to ask someone from the Spanish interpretation room to come in and let folks know how to find you, please.
Buenas tardes. Para encontrar los intérpretes en español, por favor, opriman el globo que está al pie de su pantalla, escojan la palabra Spanish y así nos pueden escuchar. Gracias.
Thank you, my friend. And now someone from the Somali interpretation room, if you could come in and let folks know how to find you.
galab wanaagsan waxaa soo gelaysiin meesha oo luqadda ku qoran tahay ama luqadda ku qoran tahay Soomaali hadaartid inaad soo geshid waxaad taabanaysaa hoos telefoonka meesha 3 dhibac ku qoran dhinaca midigta ayaa soo gelaysaa luqadaad dooranaysaa meesha ka maqlaysa turjumaanka mahadsanid.
Thank you for doing that as well. All right, so before we get started, I just want to also recognize the month of May. So the month of May is Asian American and Pacific Islander Heritage Month. This is a month celebrating the achievements and contribution of a lot of Asian American and Pacific Islanders here in our nation. Understanding that can't just be singled out by one month, but I just wanted to honor that. May is also Mental Health Month as well. So a lot of cool things going to be happening in the city when we do our bi-weekly share out. We will include some of those events for folks to be able to participate. All right. So with that, want to welcome you all again to our May 3rd Community Partners Call. Just for clarity, are you guys able to see the PowerPoint on the screen?
Perfect. Yes.
Okay, thank you. Some of it is going to be very redundant to the last meeting that we had, but I just want to refresh folks as a lot is going to be happening by the end of next week. So talking about our COVID testing site closures, around testing, just a reminder, and we'll talk about this later on in the PowerPoint as well, but those sites will all be closed by the end of next week. But the following sites did close at the end of March, so we've had a month of April without these testing sites. But as you can see, Auburn, Harborview, Rainier Beach, Shoreline, and West Seattle have been closed, and that has left us with 2 testing sites. These testing sites will be open until May 11th, and those are located in Bellevue College and one in the University District. So these 2 sites are the last 2 remaining COVID testing sites here in King County. If you're still looking to obtain free COVID testing sites for a PCR test, we have just over a week to get into these 2 locations to get that test. As we said, we'll talk about kind of what's happening on May 11th in the following slide, but just wanted to remind folks of where these 2 testing sites are still located. So come May 11th, we have some local health clinics and pharmacies are going to continue to provide low-cost PCR testing. I forgot to take out the word free, but these are going to be by appointment only. And let's just get to the next slide here. All right. So come May 11th, we are no longer going to have free COVID-19 tests. You will not be able to get them free at grocery stores. You will not be able to jump into COVID testing clinics, and it's going to be by appointment only. We still have over a week left where you can go to the State Department of Health or the DOH to obtain and operate their Say Yes COVID test program. Here you can get up to, it says 5, but I believe they pushed that down to only 2 COVID home test kits, 2 per household. And this is going to be based on your zip code. So for instance, my zip code right here wouldn't qualify me to receive any of these test kits, but you can try plugging in your zip code and see if you do. I'm in the Lower Queen Anne area. I know there are many zip codes out there where you can still get the free test, but not all of them. Also, the COVID-19 test kits from the federal government are still in operation until May 11th as well. So that is another way for folks and community members to get 2 COVID-19 tests mailed directly to you before we start seeing these changes come on May 11th. So May 11th is the big day that we keep talking about. Again, we have testing clinics closing on May 11th. Folks who have insurance will still be able to receive COVID test kits, potentially at a copay rate, or a lot of your insurance is actually going to just take care of that testing for you. Kaiser Permanente will have no cost around, getting a COVID test, but it's just going to be, it is just going to be by appointment only. Or you can do, those at-home COVID tests that you have to get your results that way. And this begs the question, the other changes after May 11th, the supply of COVID vaccines are going to be free until we run out of that supply, and that supply is supposed to last us till the end of summer. So if we look at potential costs for COVID-19 vaccines and antiviral treatments, they are currently free to the public, and they will remain free even for people who don't have insurance, as long as the large supply and vaccine and medication last. So again, we are projected to last pretty much at the beginning of fall, the end of summer. We're going to have a lot of events, locally here in King County, a lot of health fairs, and you can even still get them free at any pharmacy or where you go seek medical treatment as well. There will be no cost around COVID-19 vaccines until the federal supply is over. After this free federal supply runs out, the vaccines and the treatments are going to shift to the private market. And this is kind of on par to the flu shot that we get. That is shifted to the private market. And folks who have limited insurance or no insurance often get faced with a copay around the flu shot. And we are projecting that same cost for the flu shot to be the same cost for a COVID-19 vaccine, whether it be a primary series or a booster. So although we don't know the number, we're kind of projecting it to be around $50. And this is kind of continued on, but I will pause here to see if there are any questions, and I do see some chatter in the chat box as well. So looking at the chat box, we have folks that have put in the free test kits. And again, for the Department of Health, to order your free test kits, you have until the end of next week, and not all zip codes qualify. And for the federal government, all zip codes nationally qualify, and you get 2 mailed to you. But again, that is up until May 11th, which is, I believe, Thursday of next week. All right, so I don't see any questions. But we kind of just went over this, and I'm just going to repeat it again. So getting the COVID vaccine is going to be very similar to getting the annual flu shot and other routine vaccines. COVID-19 shots and boosters are always going to remain free for children under the age of 18. This is regardless of insurance. Childhood immunizations are free, and the COVID-19 primary series boosters, the new bivalent booster, are all going to be covered under the childhood immunization program. So anyone under 18 will never have to pay for a COVID-19 booster. And in addition to this, most commercial insurance companies, Medicare and Medicaid programs, are still going to be covering the vaccines for their members. So really, the focus right now is on what is that copay price for folks who don't have insurance or have limited access to insurance. That is still unknown, as they do have that Federal Reserve. But I think as we get closer to, the end of summer is when we're going to start seeing a price tag associated with these vaccines for COVID-19 for when the Federal Reserve kind of dries up. Let's see. So, like we've been saying, later this year, people are going to have an out-of-pocket cost for COVID-19 treatment. And this, again, is all dependent on the insurance you have. When we talk about, COVID-19 treatment plans that are different than the COVID-19 vaccines, we're going to run similar costs for people around other traditional drugs. So typically what you would pay for your average copay on medicine is what we think that we're going to see on COVID-19 treatments. So, and if anyone has any questions, please don't hesitate to ask. And I'm also curious to know if folks have been hearing anything in the community, if they've been, just kind of what the community is saying. It's always good to hear what you folks have been hearing, if there's been any pushback or if there's any worry, so we can either elevate it up our chain here and maybe look for some answers. So I do kind of want to put that out there for folks to keep that in mind. If you are hearing anything, to please let us know. And lastly, on this slide that I currently have is the federal government is working with the vaccine and the treatment manufacturers to ensure the patient assistance programs that provide free access for these products are easily used and they're broadly accessible. All right.
Hey, Justin, I have a question from someone who directed me, but is there a plan around like undocumented folks and the vaccine? Will it still be available for them when the supply runs out, or do we have any messaging around that?
Yeah, I don't necessarily have direct messaging on that right now. I will say in the immediate, so that vaccine supply, while we have it until the end of summer, there's still going to be no ask for identification or any requirements around that. You could pop in and get a vaccine, very low barrier still. And once that Federal Reserve runs out, we're going to have access points. So a lot of the public health clinics are going to be hopefully offering COVID-19 vaccines at that low barrier access, and also local health fairs put on by nonprofits and stuff like that, or various clinics throughout the city that often work with these issues. So although we are pivoting to deal with a lot more institutions around healthcare, like where we go and get checked out, like your Kaisers or your doctor's offices, I think we're right now just still trying to mitigate access points for folks who are underinsured or have no insurance, which some folks could be undocumented in that category as well. So no concrete, I guess, answer for that, Celie, but we still have some time to work that out. So in the immediate, we have until end of summer, and it's still going to be very low barrier, low access to obtain the COVID-19 vaccine. And anyone under the age of 18 will remain getting it for free as well.
Thanks.
Thank you. All right, so we kind of talked about this in the last meeting, and I just kind of want to bring it up for folks as well. And again, I'm curious to know if anyone in their community has seen this happen or has any feedback for us. But some people may need to re-enroll for Apple Health, or Medicaid coverage. So The COVID-19 federal emergency declaration, it temporarily prevented anyone from losing their Apple Health Medicaid insurance, even if their income made them non-eligible. So with this order ending this spring on May 11th, next week, some people will be required to complete a renewal application to keep their Apple Health coverage. So in the coming months, some folks have already received those letters. Apple Health users, not every Apple Health user, but some Apple Health users may receive a letter from the state for renewal instructions, and you have to respond to that letter within 16 days. So there is a link that just got dropped in the chat. It's important that you make sure that you or the community members that you serve have an updated mailing address so that they can be contacted, so they don't have a lapse in insurance if they were to have been mailed out this letter. We are working with a ton of various community partners currently now and also in the coming weeks as that declaration ends on May 11th, that can assist anyone who may be at risk of losing their Apple Health. And we also have health insurance navigators as well who are able to assist you within this journey of, making sure you don't lose your Apple Health. And there's a phone number there as well. So community health workers are a great resource for you or your community to make sure you don't lapse in that Apple Health coverage, because that is very important, especially as we move forward around this declaration and making sure things are covered for you medically. All right, so we kind of touched upon this a couple slides ago, but around treatments, so COVID-19 treatments and the antiviral medications, one of them is going to be Paxlovid. So the government has purchased, and they have, same as the vaccines, a stockpile, and these are going to remain free until the supplies run out. Once the supply runs out, like I said, we're going to start seeing a price tag around some of these things, and it's probably going to be out of pocket, but people with insurance are just going to see on average what you would typically pay for pharmaceutical drugs as a copay, $6, $10, $18. Every kind of insurance is different. But what this doesn't address is for folks who are uninsured or low insured, and what are these price tags going to be for these antiviral medications, one of them being Paxlovid. So unfortunately, we don't have too many answers around the uninsured or less insured department for when it comes down to price tags, but more to come. All right. This one, I've had it in my slides now for about 3 months. Talking about on April 3rd, we ended the mask order here in Washington State. Prior to this, it required folks to wear, masks in healthcare, long-term care, and adult correctional facilities. Anyone over the age of 5 and older were required to wear these masks. As of April 3rd in our state, folks no longer have that requirement. It then becomes down to the institution. I can safely say that a lot of the healthcare facilities that I've been in and around since April 3rd, which has just been a month now today, still are requiring folks to wear a mask. If anyone has a story on this or of institutions that they've been in, whether it be a healthcare, long-term care, or a correctional facility where you maybe haven't seen that mask mandate, I'd be very interested to hear how you felt towards that. But essentially what it comes down to is that destination and what they decide or deem fit for the safety of not only their employees, but also the community at large as well. So there are a couple things as well. If you are working in an establishment at a healthcare facility, long-term care, correctional facility, and you choose to stay masked, if your employer is saying you don't have to, you do have a lot of prevention and control guidance on your side. Worker protection requirements are still going to protect you, as you have the right to, wear a mask. And these are going to stay and remain in place until after for another week. But I've been hearing that when it comes down to the worker protection requirements, they are working on kind of extending that till after May 11th, as some folks still choose to wear a mask and they should have protection around that from their employer. But I haven't heard anything regarding that. All right, so before we kind of get into COVID and where we are kind of at right now, I know this is an old map, but it definitely reflects where our current trends are. But I do want to ask folks if they have any questions regarding any of the past information that we kind of talked about, because we are on almost the final week here before we start seeing a shift. And that shift is going to be May 11th around things that we've been used to for the past 3 years. I'll kind of give it a pause here for a second. All right, perfect. It also allowed me to have a water break and not have to show you what I look like drinking water. All right, so talking about COVID, as we're still in this world, we're still seeing COVID in many parts of the globe and also here nationally as well. But generally, the COVID-19 burden is decreasing in the US as a whole, and especially here in King County. We have done a great job locally and statewide as well of decreasing that burden of COVID. We've seen the case counts dramatically drop. There's a couple reasons about this when it comes down to self-testing and reporting, but we're also basing it upon hospitalizations and general sickness around COVID-19, and we've done an amazing job here in the county since the pandemic has started. We are at and have continued to be at a very low transmission rate for COVID-19. The trends just keep trending downwards. Before in the pandemic, anytime there was a long weekend, anytime the sun was shining, anytime a season seemed to hit, we would have an up spike in trends. It is not like that right now. We've come, I think, hopefully those times have passed, but our trends keep going down. Our hospitalization rates are dropping. Our case count is dropping, and the case count, we'll talk about that in a bit, but for the most part, we are on the decline and have been steadily since the start of 2023. This is the part that I do want folks to keep in mind as well. So we have a lot of at-home COVID test kits, and especially after May 11th, when we're going to start seeing a cost around testing and no more test clinics around town, folks are going to be doing a lot more at-home COVID tests. So what this does is we really want the information to get back to public health. But we know that when folks are sick and they are testing, when they are tested, they're not giving that information, back to public health. And that is where our case counts don't actually have a solid reflection of kind of where we are. We are also in a trend that folks who are sick aren't testing, whether they may have COVID or not. So just a general reflection of our case count is truly off, as this has kind of been an issue now for the past year since the introduction to at-home COVID tests. And then I do see Mary wrote in the chat box, it seems they know a good number of people who have caught COVID in April but didn't have severe symptoms. I can agree with that. I've known a couple of people who have caught COVID, and we're seeing agreements in the chat box as well. And I had, one friend who didn't have severe symptoms and one who was just really lethargic. So it is still out there. COVID is, going to be here. It's not going away. Kind of just reflecting on the case counts, I think that a lot of folks, who test positive to COVID aren't reporting those cases back, which, helps in the overall downward trend where we are. But the realistic side of things is COVID is still there, and the numbers are going to be a little bit higher than what we're seeing in dashboards. Just Just give me one. Sorry, I'm having my corgi freak out for no reason. All right, so she's going to continue to bark. But so public health receives data from people who seek out testing. This is kind of what we just talked about. The case counts come a little bit more reliable, and one way to kind of, keep our data in check is we turn to hospitalizations and also look at the death data for the disease burden. So we do have a downward trend in our hospitalizations right now, although our case count may not be reflective of the actual number of cases around there. It is still with confidence that we can say that, overall we are trending downward with COVID-19. All right, I'm going to skip through those, and we're going to go here as a reminder. So vaccinations, and we're going to be talking about vaccinations moving forward, but vaccinations keep hospitalizations down. They're going to keep our death counts down, and they also help in curbing, long COVID as well. We do have an updated bivalent, second booster that we're kind of going to be talking about later on, and just go over, overall boosters and COVID-19 vaccine information in just a second here. But when we talk about our primary series, I do see a question in the chat box. How and where can people dispose expired COVID test kits and expired hand sanitizer? Yeah, so we've had this question before, Lena, and thank you for bringing it up again. So we don't necessarily have a drop-off clinic where folks can go, recycle these used things. So we're recommending that folks just throw it away in their trash. If the box on it says it's recyclable, then please do recycle appropriately. But other than that, we do not have any special places that folks can dispose of, expired PPE. But expired COVID test, a good rule of thumb is when you do your at-home COVID test and you put the solution in the mechanism that is going to tell you if you have COVID or you don't have COVID via a 1-line or a 2-line system. If you put that solution in there and you don't see, the solution bar go up the strip and you don't see any lines, then you know that that test kit is expired. For instance, my test kits at home right now currently expired December 31st, 2022, but the test strip is still working. I'm still able to see either 1-line or 2-line. So I know that they are not expired on my end. And a lot of test kits as well have extended their expiration dates. But just a good rule of thumb, if that the solution bar does not move up and you're not seeing any lines, then you know that either that is a faulty COVID test, at-home COVID test kit, or maybe your batch is expired. And if you do have an expiration date and you're still seeing those bars, then it is good to go. 1 second. Sorry, team. I put my corgi upstairs. She was barking. All right. So talking about our primary vaccine series here in the county. So we have 85% of the population, which is just under 2 million people who have completed who have completed their first and second dose of the COVID-19 vaccine. So what we kind of want to work on is these second 2 numbers up here. So up to date is going to be, everyone who has had their primary series, they've had at least one of the original boosters, and they have received the updated bivalent booster, not the updated one, but the updated one before. So we have a 32% population on that. And then folks who have received, the bivalent booster, we only have 31% of the population. And these are the numbers that we kind of want to fix and kind of bring up. And it is, it's still important right now. After May 11th, we have until summer where vaccines are still free. So for folks who, may be on the fence, it's a good time to start messaging around what is going to be coming in the fall when we start seeing a price tag with COVID-19 vaccines. Again, for most people who have insurance, this may not be an issue, but for folks who have limited access to insurance, less insured or not insured, getting that booster, the bivalent booster, or even their primary series before they start seeing a price tag is kind of the messaging that we're trying to focus on right now. We have till the end of summer. So some numbers for you all there. We typically have annual boosters made available in the fall. And the reason why we do this is it allows for updates based on the circulating variants. So to kind of put that into perspective, we've heard a lot about the Kraken variant or the XB 1.15 variant that was kind of going around the end of winter, January, February months. That will most likely be in the updated booster that they're going to be kind of working on now, that we're going to kind of see be implemented at the beginning of fall. And what these boosters do is they provide a little bit extra immunity protection, and especially those at the highest risks. So they take the original vaccine and they're just kind of tweaking it. And this is kind of what they do with the flu vaccine. Except the flu vaccine is more of a prediction of what they predict to be that flu that year, whereas the updated boosters around COVID-19, they're actually pulling proteins from said variant in the months prior. So that's what we kind of expect this COVID-19 world to be on a yearly, annual, fall basis when it comes down to boosters getting updated. So I will stop there for a second. I know folks are utilizing the chat box. I want to thank Gina and Seeley for putting links, but offering an open mic here if anyone has any other questions before we kind of dive into the bivalent booster, especially as we have a new updated one. All right. So the bivalent booster. So this is the Omicron fighting booster. We've heard about it many times. It is a booster that has the original virus in it, and it has the Omicron variants. It is one single shot, and you can take it 2 months after your most recent COVID-19 vaccine, so after the primary series, or after your booster before the bivalent. The side effects of this booster, and even the new updated bivalent booster, and most all COVID-19 vaccines just in general, the side effects are going to be very, very moderate. You might have them for 1 or 2 days. You're going to feel fatigue, sore arm, and those are really the two that kind of stand out. And then when we talk about who can have the bivalent booster, for Pfizer, it's 5 years of age and older, and for Moderna, it is 6 years of age and older, and it is okay to mix and match. Just want to throw that out there as well. If you got a Moderna primary series, you can get the Pfizer bivalent booster and vice versa. All right. So again, getting the booster is going to help protect your body's protection. The first vaccine, as that weakens over time, you may get COVID, but having a booster means you're just not going to get as sick. They have fewer symptoms and a milder disease. And they also help prevent community spread. So boosters make people with COVID-19 a little bit less contagious. And when you get your booster, you're kind of doing your part as well. And we do have a new updated booster that I kind of want to talk about before I go back a couple slides. So the new updated bivalent booster. So who is eligible for this? So anyone over the age of 65, as people over the age of 65 are among the most acceptable and severe outcomes for COVID-19. And these individuals, they're able to receive their second bivalent booster. If it has been at least 4 months since you got the first bivalent booster shot. And if you are over the age of 65 and you have not received any bivalent booster, you can go straight to the second updated bivalent booster. And as well as, folks who are over 65, and we've heard this messaging before. So from the CDC is that anyone 6 and older with moderate or severe immunocompromise can receive a second bivalent booster if it has been at least 2 months since you've received the first one. So that is kind of what we're wanting to talk about right now, is this new bivalent booster. This is very small print. When we do the follow-up, email in a couple weeks, this PowerPoint is going to be on that email, which will be a heck of a lot easier for you to read. But I'm just going to highlight some of these points here for folks here and for folks who are also in the interpretation room as well. So the bivalent booster, as we know, became available in the fall of 2022. And the updated boosters are all typically called updated because they protect against both the original viruses and the Omicron variants. The 2 COVID-19 vaccine manufacturers, so Pfizer and Moderna, have developed updated COVID-19 boosters, which has led us to this new updated bivalent boosters. The second bivalent booster is the same as the previous booster. In other words, it contains 2 mRNA cells, one targeting the original strain of COVID, and the other targeting the BA.4 and the BA.5 Omicron subvariants. It is just going to be the booster that we're going to be using moving forward. Right now, we're just prioritizing that older population of 65 and older and folks who are immunocompromised. And let's see. All right. Sorry about this. This is all good now. So talking about COVID variants. So why do we have COVID variants? So viruses are always changing. The more virus spreads, the more it changes. And when a big change happens, scientists call it a new variant, which is what we've consistently seen, since the original COVID strain has, landed upon us. So as anything, scientists are worried that we're going to keep mutating from the original virus, from these different variants. They're going to become easier to catch and spread, especially as we start, weaning back our declarations or our mass safety or our PPE protocols and stuff like that. So it's always good to keep up with your washing your hands, keeping up with your safe distancing, and there's definitely going to be more variants to come. It's just we need to hopefully just learn from each past one and keep up with our vaccines and our boosters. I will stop there because that was pretty heavy in text. See if folks have any questions. Perfect. And it is beautiful out right now, so I understand everyone's urgency to kind of end the workday and get back out into the world because it is warm. All right.
Justin, I have a question. Someone just messaged me. Is county still supporting vaccination events? How they were doing those community vaccination events for specific communities.
So we still are, definitely. After that May 11th, though, is when we're going to start seeing things shift a little bit, but county is still supporting, especially around childhood immunizations, and as we look to a lot of back to school events as well. Are you talking strictly about COVID vaccine support, or are you talking about all different types of support?
Those COVID vaccination events that they were doing with, everything shutting down, I think is what this person is asking.
Yeah, it's right now they definitely still are. It's just going to look a little bit different as funding is going to be heavily tied to COVID-19 vaccines. So not sure where that is going to land with the price tags around them, around, health events. But the DOH also has a van that they go around town in, which will help offset some cost. But I think we have a lot to learn about what's in store next, especially around community and community vaccination events around COVID, because it's going to be heavily tied to finances and money. So I don't have a clear answer per se.
Perfect. I'll just grab their name and follow up with them. Thanks.
Yeah, follow up, and then also they could email us, and then we can help set something up or mitigate any issues that they have. Sweet. So we're talking about vaccines around kids, childhood immunizations, childhood COVID-19 vaccines. So I will briefly go over this, and then we'll kind of hopefully move a little bit past COVID and talk about some other things that are happening here in the county. So children, they should complete the full series of doses for the vaccine to be effective. So the Pfizer, we have 3 doses for children, 6 months to 4 years old. Moderna is 2 doses for children, 6 months to 5 years old. The side effects are pretty on par to those side effects that you see in the adults. Soreness, where they get the shot, irritability, crying, fatigue, and a little loss of appetite. Less common are going to be the nausea, the vomiting, the fever, and the chills. All right. So are the COVID vaccine doses for children the same as for adults? No. Children under the age of 5 receive 3 microgram doses for Pfizer. Children under the age of 6 receive 2 microgram doses for Moderna. And the doses change, as the child gets older, from ages 5 to 11. And then for children 12 and up are all going to receive different doses, which are different doses than those folks who are 18 and over. Yeah, and we kind of talked about this as well, but staying protected against the new variants. First and foremost, you want to protect you, your family, and your bubble. Whether that is wearing a mask, social distancing, but definitely keeping up to date with your vaccines and your boosters as well. That is going to be one of the safest ways you can protect you and your family moving forward. All right. Again, I'm keep taking breaks here, but this is kind of the last of the COVID updates before we have a couple other, public health announcements and things we want to talk about. So before we move on, is there anyone interested or anyone have a question they're interested in having an answer to, or perhaps want to share an experience they've had recently in the past month, or any fears they have with the declaration ending on May 11th? Feel free to write it in the chat box or come talk. Oh, I do have a question in the chat box, and it is around the updated bivalent booster. So I might have confused folks. So the updated bivalent booster is the same as the original bivalent booster, except we're trying to keep folks who are 65 ages and older and the immunocompromised individuals to have a little bit more protection. So the second round of bivalent boosters is available now for folks 65 and older, and for immunocompromised individuals that they can go in and get that updated bivalent booster. Before, there was no messaging around that. Do I get another booster? Can I not? And the CDC has put out there that yes, if you are 65 or older, it has been 2 months since your last booster, or if you're immunocompromised, you can now get a second bivalent booster to keep you as safe as possible and updated as the vaccine weakens a little bit greater for folks who are immunocompromised or over the age of 65. So apologies if I made that confusing, but that was a question in the chat box. It's a direct message, and I kind of wanted to address that.
Also, I threw the link in from the last slide Justin just shared about what doctors wish patients knew about N95. So That's what that link is for.
Thanks, Seely. All right, so recently in the news, if folks may or may not be aware, there was an outbreak of a infection called Klebsiella. It is a bacteria that can lead to infection, and it's typically found in hospital settings. So this is a common bacteria that can be part of a normal bacteria that is living in our bodies. It's definitely in our intestines. However, sometimes this bacteria can enter a part of the body where it's not normally found and can cause very strong infections, such as urinary tract infections, surgical site infections, and pneumonia. There was a recent outbreak with around, I believe, 30 cases at Swedish Medical Center with this Klebsiella. I think the first outbreak, I might have wrote it down here in my notes, but there is a link here that you can read all about it. And let's go to the next slide. Let's go back one more. So cases of Klebsiella associated with the outbreak, they were identified, starting in October 2022. And as of the end of April, we were aware of 31 cases and 7 people had died since the outbreak began. So all cases have been found at Virginia Mason Medical Center here in Seattle. And then kind of going back a slide, I just want to kind of break it down a little bit more for self-awareness as well. So a person's risk of infection depends on a number of different factors, which may include procedures that they've had or whether they have a weakened immune system. Klebsiella bacteria, it doesn't spread through the air. So very different than COVID. Does not spread through the air in its healthcare settings that the bacteria can spread person to person. When you come in contact, often on contaminated hands, and you can find it on various equipments, or if you're going through a surgery on some of surgical devices. Additionally, the bacteria may contaminate surfaces, like I just said, and it can spread from equipment to the patient. So all that being said, has led us to 31 cases, which can all be found at Virginia Mason Medical Center. So just for situational awareness that is kind of going on here in our county. And then I do want to touch upon food insecurities in King County as well. So it remains high. And we've listed a bunch of great resources. You can help and get food assistance to your community. So when we send this slide out, you're going to have all these beautiful links. So basic food, SNAP, the SNAP Market Match, and SNAP Produce, Women, Infants, and Children Supplementary Nutrition Plan, Senior Farmers Market, Nutritional Program as well. A lot of great resources. School meals, summer EBT, Seattle Fresh Bucks, and food banks and meal programs, all here in the county as well. So as we kind of pivot from COVID-19, especially with a lot of these declarations ending, we're kind of turning towards the social determinants of health. We're trying to take the lessons learned from COVID-19, especially here at Public Health, and take those lessons learned and apply them to the social determinants of health, so we can start tackling, some of these things. And one of them is definitely around food insecurities. A couple other examples, transportation or rental assistance as well. But as we make that pivot, and especially as these declarations end, you're going to start seeing a lot of conversations, even in these meetings, kind of shift as we start aligning with the social determinants of health within the county, and we start talking about other things that are branching away from COVID that were made much worse by the pandemic. But as we pivot, we're going to start focusing a lot more on those ideas and situational awareness and so on and so forth. So if you in your community are wanting to hear about a certain topic or certain resources out there, please don't hesitate to reach out to myself or Seely. We can, kind of take those high level concerns and either talk about it in a meeting or find some answers for you as well. Again, as we start making this pivot here to talk about the social determinants of health. So we plan to be around, we plan to run this meeting, forever, almost indefinitely. And hopefully we start seeing less and less of the COVID conversations, and we start talking about more of like food insecurities and rental assistance and general health and well-being of King County members that are kind of outside of the COVID bubble. All right. So we talked about this last meeting, but we want to change how the US Census and Federal Survey procedure racial and ethnic data. So there is a link, but you can take steps now to kind of change how the US Census and federal surveys produce racial and ethnic data that is used for redrawing voting districts, enforcing civil rights protections, policymaking, and research. This is one of the first times that the government has done a survey asking for feedback of how they can, change something that has kind of been implemented for the past century. As you see on the screen, there are very outdated terminology and uses of words and phrases that should no longer be in anyone's vocabulary. So this is a good link. Definitely tell community members about this. One of the first times the federal government is asking for our feedback on how they can do better. Yeah. And with that, my friends, I'll be around for some questions. The next meeting is going to be the end of May, and then we're going to follow that up with an end of June meeting. We're working in 4-week patterns here. So once every month, once every 4 weeks. May is a little bit longer. We will hold these meetings. We've structured our follow-up emails to be a little bit differently as well. They're coming from a GovDelivery email site, hopefully to be a little bit more structured, to offer a little bit more. Within those GovDeliveries, you're going to see the PowerPoints, the live recording of these videos, and other useful information that we either touched upon, talked about, or that is coming up. You'll get 2. One is going to be a more detailed email. The second one, like you all got yesterday, is just going to remind folks of the meeting that is tomorrow. So with that, my friends, I will adjourn this meeting. We did it just under an hour. It's a beautiful sunny day. I'm antsy to get back outside and walk the corgi. But if anyone has any questions, I will be around. And if not, I thank you all for joining us. Thanks, everyone.